Let's take a look once again at the demands of these doctors from the federal government. They are asking for immediate payment of the shortfall of their COVID-19 allowances for non-clinical staff, okay, in the federal health institution. Also, they are asking that the COVID-19 allowances for clinical and non-clinical health workers, have to be domesticated, okay? That's what they're asking in both the states and the local government. Also, they're demanding for COVID-19 palliatives now for citizens, and they're also asking the government to take a look at the decaying health infrastructure. Also, they are demanding that the Minister for Labor and Employment, Chris Ngige, should be replaced with Festus Keyamo, because they feel Ngige has actually compromised, on everything they've agreed on prior to this time. Now, let me hear you, Prince Chilaka.
Well, I want to start from the point that there has not been any negotiation between government and I want to use labor to start with that has worked. This is a country where the labor and government sat down and agreed on a minimum wage of 30,000 naira. We should be asking ourselves, how many state governors are paying this 30,000 naira? As we all sit here today, we know that some governors are owing 6 months. Some are owing up to 9 months. So the problem in the health sector is a carryover from other sectors. It's a carryover. Yes, I know that, yes. For me, I believe that those who are in the front line of fighting COVID should be taken care of. So, what Dr. Maduka tried to talk about. This is a country as a minimum wage is a problem. Paying doctors for putting their own lives on the line is a problem. Yet, we keep hearing of school children feeding when children are home. It's all about misplaced priority. I would have thought, like I kept saying, and I'll keep saying it, all the money that was said to have been spent feeding children when they were at home, because my own child wasn't fed, I don't know if your child was fed, but all the money that was budgeted and that was used for feeding them would not have been enough to be put into the health sector. Today we're talking of India having doing 1 million testing per day.
1 million plus.
It means that the government is working. They have put priority where they should put it. Health is wealth. Without health, the economy would not grow. And I think it is time that the government begins to realize that. That is one. Two, I also believe, I would support them. I believe that the Honorable Minister for Labor, Dr. Chris Ngige, if you listen to his outburst sometimes, you ask yourself, how did we get to this point? A minister is supposed to be a father to his ministry and to those under him. But when you begin to lash out at people, you don't listen to them, you don't carry them along, then something is wrong. So they're asking for him to be replaced. Ordinarily, what they should even be demanding for is for the minister to go. Unfortunately, Nigeria is a country where people don't resign. Because if this is a country where people resign, we know that a lot of ministers would have resigned by now. Because a lot of ministers are not helping Mr. President to achieve his aims. Let us put it the way it is. I keep saying it. Those who sit and advise Mr. President, sometimes they keep Mr. President away from the people. But the truth is that, yes, the doctors demand. This is not the first time we're hearing of strike.
But looking at the demands of those doctors, are these demands unreasonable? That is the question.
The demands are reasonable. Sorry, okay. Why I'm saying that they're reasonable is that, you see, and I also want to blame these doctors. And I keep blaming the unions that, husband these doctors. Because tomorrow, they sit down, half-baked decisions are reached, they move on, hoping that it will get better. It never gets better. I think Nigerians are getting fed up of every day one threat of strike or another. That is why nobody takes Nigerian Labour Congress serious anymore. Because they will only come out when it is them, not when it is Nigerians. But if you look at the demands of these doctors, you find that apart from demanding for themselves, they're also demanding for Nigerians. Because they know that it is pinching everybody in the country today.
Yeah, in addition to that, I think the problem is not to me. The problem is a general rottenness in the system. Ngige is a medical doctor. You see, you don't give somebody something you know that person cannot, and that's why I love the Europeans. Sorry, I'm always using it. Merit. And before they put you to a place, they must ensure that you merited and you can deliver. And they cannot, the medical doctor and labor, there's no way it could work. There's no way, because he's not trained to manage human beings in terms of administration. But he can manage human beings based on what is, in injection or the body system or whatever. But when you talk about physical management, it is not the work of a medical doctor. So it's not only Ngige, it's transcend to all facets of our life in ministerial. Why did China took to the idea about meritocracy? It's merit. Why do we go down, like, I don't know what we're going to talk about. People are saying there's no money, there's no money. Why is there no money? Because there's no money because the people you put in certain positions are not delivering because they are not experts to that particular sector. For instance, can you take, okay, I'm an accountant, you take me and say, go and be a lawyer. It's not going to work. I'm not a lawyer. But you carry a lawyer, you put it to national planning. National planning, for Christ's sake, is calculations. It's statistics. So everything, when I started this, I gave you the breakdown of budgets. You have to break it down so that a layman can know what is the percentage of this to this. It's different from if somebody is reporting to you and giving you, so I tell you what to do, than what you know as a person. When I was working, let me give you an instance. There's an engineering work, and somebody brought it, and you know what they call that in botulistic sphere. That's what they don't call it. And they quoted a ridiculous amount. And I wanted to know, what is this? Do you know what that is? Bolt of 5 naira. Because I'm a layman. So imagine you put a lawyer as to take care of your works and housing, and these engineers cook up an epitome, an terminology, and pass to you. You will not know, except you're inquisitive. Because I am an auditor, so I'm inquisitive. I said, the guy came many times. I said, no, I want to know the meaning of this botulistic something. Because I have not heard about botulistic. Botulistic is something I know is when you talk about in biology. But this one, I need to know. Until he now opened up that they are bros, boat. I said, boat. And you're quoting this kind of amount. So these are issues. We must start now to reinvigorate our system. And the system is fundamental. Put people at the right place and they will deliver. That is what is happening. Today we have many Nigerians that are working outside because of what? Because they are put in the appropriate place of their professionalism.
Okay.